Okay, so we have two participants today. I'm going to be doing the foot and toe evaluation. Kylie may hop in and out whenever she so pleases, so just bear with us here. Yes, I know, you love the camera. The camera loves you. Okay, so I have my patient here and her foot propped up. We would start by taking a past and present medical history of the patient. Yes, okay, not you, just sit, okay, thank you. Yeah. Then we'll do an inspection. We'll do a check for swelling, discoloration, and deformity. We will check the arch while weight bearing and non-weight bearing to see if it's pes planus or pes cavus, to see if it's flat-footed or a high arch. Then we would check the toe position to see if, okay, can you stop? We check the toe position to see if she has mallet toes or hammer toes. They would be like kind of like caved in like this, and she seems to be fine. And then we would see if they were valgus or varus to see if they're like more away from the midline of the body or towards it, and hers also seemed fine. And then we would check the toe conditions to see if she has any like blisters, corns, hematomas, warts, ingrown toenails, and calluses. And she seems pretty fine there too. Okay, great start. Then we'll move on to palpation, starting with the bony palpation. I'm going to start by palpating the first metatarsal, the hallux, and I'm checking for hallux, valgus, and bunions. So, here we go, palpating. And then we'll palpate the sesamoid bone, which when I was looking at pictures, like I wasn't sure if it was on the front or the back. I think it's on the back, like right here, but it could also be like right here. And we're checking for sematosis. And then I'm gonna palpate the fifth metatarsal right here. And here we're checking for bone Jones fractures or ulversion fractures. And then I'm gonna palpate the cuboid bone right here. And that's checking for peroneus longus tendinitis. And then I'm going to palpate the calcaneus, which is the heel right here. And that's checking for apophysis and heel spurs. And then I'm going to palpate the talus and navicular displacement for the talus right here and navicular displacement. Please, you're interrupting. Hold on. Okay, then, and we're checking those for the pes plantus. And then I'm gonna move on to soft tissue. I'm gonna palpate the plantar fascia, which is underneath the foot here. It starts at the heel and kind of like spreads out into all the toes. And that's for plantar fasciitis. And then we will also be doing between the metatarsal heads of all of the toes. So here. And that's checking for Morton's pneumonia or neuroma. and then we're gonna do some special tests. So I'm going to remove the chair. My knees are so bad. Okay. Okay, so we're gonna start with the ridge versus supple pes planus test. So I'm gonna have you lift your foot off the ground. Perfect. In a relaxed position. Okay, yeah. And then I'll check her arch to see what it looks like here, and then go ahead and put it on the ground. Okay, so what I was looking for is to see if it flattened or changed a lot when she put it on the ground. It didn't, so she got a negative test, which is great. Then we're gonna move on to the navicular drop test. Okay, so my handy pen, I have to draw on your foot. You can wash it off. It's washable. It's highlighted.
I just washed my foot.
Okay, well, you're gonna have to wash it again. Sorry about it. Deal with it. This is for science.
Got it.
Okay, so I'm gonna have you invert your foot and slightly pronate so I can find. What's wrong with your foot? I think it's around here. Okay, so this is around where the navicular tuberosity is. Okay, so go ahead. That's probably a little lower. Like here-ish. Then I'm going to apply equal pressure to her. This is in subtalar neutral position. This is where her navicular tuberosity is. And so then I would like apply equal pressure. I'm going to apply equal pressure to each side of the talus and see if that changes the position at all. Okay, equal pressure is applied. Nope, it's still right there. So that is a negative test, which is good. If it was a positive test, it would be 10 millimeters apart, and she's fine. So that's great. And then we're gonna do the Fees-Line test, which is testing for congenital pes plantis or functional pes plantis. So I would start by finding her medial malleoli, which is right here, dot. And then her first metatarsal phalangeal joint, which is like here.
Getting kind of happy with that pen there.
And she needs to see my face too. Just to, okay, not so close, jeez. Then I use a straight surface. I have this nifty piece of paper here that I've folded in half. And we would draw a line from the first metatarsal to the medial malleoli. And as you can see, her subnavicular, or wait, what? Her navicular tuberosity is pretty much on the line. And then go ahead and stand up. I'm gonna see if it changes position at all. It's down a little more below the line, so I would call that a functional pes plantis, and yeah, that's that test. And then you can go ahead and sit down again, Mother. Thank you. Okay. Then I'm gonna bring the chair back because I think it's more comfortable for you. Your patient's comfortable. She's a complainer. So,
shut up, Julian.
Okay, then we're gonna do some range of motion testing. We're gonna start with you can do it passively or actively. I'm gonna have her do it actively. So we're gonna invert. So turn towards me. Wow. Okay. And that's supposed to be 5 degrees. And then evert the other way. No, not your whole leg. Just your. Yeah. Okay. Evert, subtalar eversion and subtalar inversion, both at 5 degrees, and then we're going to do ab and adduction, so just to the side, not like flex and to the side. Sure. So we're going to do 4, and then the other direction. You're moving your whole leg. I just need you to move your foot. Okay, yeah, great. So we're doing forefoot abduction and abduction is supposed to be 20 degrees, and adduction is supposed to be 20 degrees, and abduction is supposed to be 10 degrees. And then we're gonna do first metatarsal flexion. Just move your front toe down. No, just your big toe. Okay, so she's doing first metatarsal flexion, and that's at 45 degrees. Well, it's supposed to be at 45 degrees. Hers isn't quite there, but we're working on it. And then we'll do extension with the big toe. Just your big toe. Okay, sure. Oh, good. Okay, nice. Okay, And so this is first metatarsal extension at 70 to 90 degrees, and then we're going to do the lesser toes flexion and extension. So these ones. And extend. Great. And those are symmetrical. And then we're going to do...
It's all connected.
We're going to do ab and abduction of the lesser toes. So try to separate them like sideways. Okay. Okay, well that's supposed to be symmetrical, so she's doing the best she can, and we appreciate that. Can you see her toes? Okay. Thank you. Okay, then we're going to move on to muscle strength and resistive range of motion testing. So I'm going to have her... I'm going to have her extend against my hand. So just your toes though. Perfect. And that's testing the extensor digitorum longus and the extensor hallucis longus. And those are both in the deep peroneal nerve. And then we're going to do flexion. Flex. Just your toes. Okay. And that's testing the flexor hallucis longus and the flexus digitorum longus, and those are in the tibial nerve. And then we're going to do some neurological testing. So I'm going to see if she can extend her toes. Just extend your toes. Okay, sure. Great. Okay, so that's L5. And then for some sensory testing, L4 is the medial side of the foot. Can you feel that? Mm-hmm. Okay, and then L5 is the dorsum of the foot. Can you feel that? And then S1 is the lateral side of the foot. Can you feel that? Mm-hmm. Lovely. Okay. Then I'm going to remove chair once again.
Can you feel it?
Okay, we're not doing her. She doesn't. Okay. Okay, so Mom, I need you to bend your foot. I'm gonna do an Achilles tendon reflex test. No, like your leg, like bend it back so I can. Okay, pretend it's off the ground, but I would just hit back here with her Achilles tendon, and she's supposed to like reflex up, like kick up, but she's not in the correct position, but it's fine. We know what we're doing still. And then we're gonna do some blood flow tests, starting with the posterior tibial artery pulse, which is back here-ish. And then the dorsal pedal artery pulse, which is right here on top of her foot. And then for both of those, And then for both of those, I would count for 15 seconds and then multiply it by 4. And then I would do a recapitalization test, squeezing on her nail buds and hoping the color comes back within 2 seconds. And then I would compare bilaterally. And that is all. Thank you.